Hi there, I'm Gabby, and this is my video for my case study report for my off-campus internship at Sunnybrook Hospital. So I'm just going to be basically talking about a patient and how it affected my treatments, and then my therapeutic intervention, and of course my follow-up and outcomes. I have my laptop in front of me so I can look at the questions while I answer them as I'm videotaping. So I'm just going to provide a brief introduction about my patient. So my patient was female, and she has been experiencing severe TMJ pain, disorder, and stiffness that was kind of affecting the way she slept and doing her daily activities because it was bothering her so much. This patient was a patient at Sunnybrook, and she was in there for some depression issues and some stress issues as well. Of course, there has been a lot of evidence, scholarly articles, books about how massage therapy can help diminish the effects of stress and depression and anxiety as well, just because it stimulates the parasympathetic nervous system, and as we know, that's the rest and digest. It makes the person feel more relaxed. That muscle tension that you get sometimes with stress, like in your traps when you kind of elevate it like this, or even in your jaw sometimes in this case, helps diminish that tension, which makes it feel more relaxed. Again, this patient was experiencing extreme TMJ, and she did say it got worse as her mental health issues got a little bit worse. She does grind her teeth at night a lot, right? So that can happen with stress. It's actually known with stress that you can clench your jaw or tighten, your TMJ joint and grind your teeth. So that's kind of known. They correlate together, the stress and the TMJ disorder together. And this topic was actually really interesting for me because I have TMJ myself, so I can relate to the patient a little bit. But also it's interesting because I want to see how the stress could really affect the TMJ and how massage therapy can gradually improve week by week those symptoms. And of course, this patient was kind of really down on herself just because she was very self-conscious about her appearance now. Just because ever since she started grinding her teeth, they started filing down and her teeth are not as straight or aligned as she would like them to be. So that's kind of the patient background as well. So that was my patient. The main concerns and the symptoms, again, she had severe jaw pain, very stiff jaw. So when we were doing opening, closing, lateral deviation, very stiff, very choppy. She had a lot of clicking in her jaw that would kind of prevent her from eating properly, even sometimes concentrating, because she was concentrating so much on the pain and the stress that she couldn't answer the doctor's questions sometimes, she said. Her current health status, again, she is in Sunnybrook for mental health issues, and she has been in there for the past 4 weeks. She said it's slightly getting better. She did have treatments throughout that the doctor prescribed her, but they were having a hard time kind of figuring out a good treatment plan for her. So that was kind of in the midst while we were doing our massage treatments. So clinical findings and assessments. How I approached this particular case, of course, we have the TMJ joint, but we all know that there's a lot of muscles that cross the TMJ joint that don't necessarily originate from the TMJ joint. So for example, the neck, there's a lot of neck muscles, SCM, even levator scap that goes, up higher, right? And kind of attaches to the neck. So I really wanted to kind of focus on the range of motion, see what she was limited in. I wasn't really too concerned about resistant range of motion or passive range of motion because there was no ligamentous issues. She didn't really have any strength problems, she said, while chewing, but it was just very stiff and she couldn't really move properly. So I really wanted to focus on the active range of motion of things, see what she can do by herself, see where her apprehension is with her movements, and what we can work on. So what I did, I first started with active range of motion of the cervical spine. So I did flexion, extension, rotation, lateral rotation, and lateral flexion. So she did present similarly. Left side was much more limited with lateral flexion and rotation in comparison to the right side, but overall her movement was limited altogether, just that the left side was a little bit more limited than the right side. And of course I had her do some simple opening and closing with her jaw and some lateral deviation with her jaw, because I wanted to see how that correlated all together as well. Her opening and closing, she could not really open very wide. She kept complaining of the clicking sound that her joint was making when she was opening it. And then her lateral deviation didn't really seem to have any problems, but again, she just complained of mild stiffness with that. So just opening and closing was really the main complaint there. So I kind of started to think with the opening and closing and the lateral deviation, okay, a lateral medial pterygoids. Of course, the masseter muscle, really big muscle, and then also I want to introduce a little bit of the temporalis, since it comes from the temporal region and kind of comes down over kind of to the zygomatic bone area. And of course that can, if it's very stiff, cause a little bit of clicking. Of course, that's more pathological, that's more joint related with the clicking, because it could be, you know, she could have some issues with her jaw, kind of the setting of her jaw. So I really wanted to focus on, of course, her jaw muscles, but I also really want to introduce some of the neck musculature too, just to kind of relax the joint below, so we can have positive effects for the joint above. So we did some upper fiber trap massage. We did SCM, scalenes. We did suboccipitals. We even did the front, so the longest colli muscles here. And then we did the erectors from the back. We just did kind of the whole musculature. We spent the whole hour kind of really loosening this area up, and then also really introducing massage to this area. A lot of techniques I used, so a lot of dynamic movements. So I would kind of compress her jaw, and she would open and close, so it would allow my fingers to sink in a little deeper. Lots of petrissage, lots of running over the muscle fibers where I felt it was very ropey. Again, same with here, lots of petrissage, neuromuscular techniques. And then also we did a lot of vibrations as well, just because that does stimulate the parasympathetic nervous system and can kind of override the pain sensation. And then my teacher really showed me a cool way to do it on the jaw, where you just cup the jaw kind of like this and then vibrate your hands for those effects. And it was really effective for her, and she really liked it. So I was glad that the teacher introduced me to that, because we kind of introduced that to her treatment at the end. So therapeutic intervention, again, we kind of went over the treatments already, but I saw her for a total of 3 weeks, just because I had her the third last week, and she kind of signed up, and she was really adamant about having me, because she really felt a benefit after the first one, and she was really satisfied with it. So she signed her name up on the list for those 3 weeks with my name beside it. And then what else here? We did the 60-minute treatments. At the end, we kind of, just to kind of give her jaw a break, and then her neck a break, we did a lot of palm work as well. She found that that felt really nice and kind of relieved her stress as well a little bit. So that was simple, just massaging, petrissage with the oil. Some neuromuscular techniques, but nothing too fancy. Let me see. Yeah, so any referrals, home care, or education. I did provide her some stretches for her neck, just because you loosen up the neck, it can affect your jaw. And I also prescribed her self-massages as well. So she has a certain treatment where I wasn't really sure what it was called, but she was explaining it to me, where something is hooked up to her skull, and it causes a little bit of a vibration, which makes her clench her jaw. So she wears her mouth guard with that, but her jaw usually hurts after that. So I prescribed some self-massage, or just even simple circles to the jaw, just to kind of stimulate it, just to kind of relax a little bit. I also prescribed her some range of motion of the neck, simple just rotations, lateral flexions where she was having problems, some stretches to her lateral flexion, so upper fiber traps, and also some range of motion to her jaw, so she can maintain that or even improve it over time after those treatments. Any referrals? So she kept asking me questions about, what's this clicking in my jaw, or why do you think my teeth are shifting, or what do you think I should do? Should I wear my mouth guard? And these are questions that are out of my scope of practice. I mean, I can make educated guesses, but I'm not a doctor, or again, I'm not a dentist, so I couldn't give her proper information about it. So I always kind of referred her to her doctor or her dentist, because they obviously know more about TMJ and then the teeth structure and joint pathology than I do. So I kind of referred her to that, because I didn't want to give her misinformation, misleading information, and of course I don't really know 100% about it, so I don't have the capability of providing that kind of information for her. Follow-ups and outcomes. Describe the relevant physical examinations. Again, we did do each and every treatment. We did a pre and post assessment, so that included the range of motion of the neck and the range of motion of the jaw. After every treatment, she did have more range of the neck and more range of the jaw, but also each week she did improve with her range of motion of the neck. She experienced less pain, less discomfort, but also when I was working through her muscles, it would actually allow me to give in more. So first treatment, it was kind of like more like rock. I could not really get my fingers or my hands into her muscles. They were really guarding. But after the first treatment and her stretches, she did follow up with the routine that I gave her. It actually let me sink in a little bit deeper to kind of stimulate or brace those fibers a little more, which was really nice, because then you can kind of objectively see what's working, right? With the active range of motion and of course the massage. But overall, subjectively, she did say she was feeling better and really wanted me to stay longer. But of course, we have another rotation coming in, so she was kind of sad about that. Yeah. And discussion. Discuss strengths and limitations of your approach, relevant research evidence related to your case. So, my evidence that I had, or my rationale for my conclusions, I have TMJ myself, so I can always relate to the patient. I always find it easier when the patient has something similar to what I have, because I kind of know what's going on. My limitations, I don't know a lot about the TMJ musculature that much. We are not really stimulated, or we don't really have a lot of people come in with TMJ, so that was my limitation. So my instructor really came in and kind of gave me really good takeaways for the treatment, really introduced new techniques that I can do into practice, which was really nice because, again, she has more techniques and experience than I do, and she really did explain it well to me, which was nice, and the patient also really appreciated that. Overall, I found that this patient, I really liked this patient. She was really nice. And of course, it was a really good experience working at Sunnybrook. I was very scared at first. I really didn't know what to expect. But I ended up really liking it and really creating some nice therapeutic relationship with these patients. And I kind of do wish that the internship was a little bit longer, because this was one of my favorite internship classes off campus. And of course, I really like the teacher that we had. Thank you for listening.